Good afternoon and welcome to all of you to our COVID-19 update. This is update number 30. It's coming to you on Thursday, April 23rd, 2020. I'm Steve Triffletti, your Plymouth Town Moderator. We're here each day, Monday through Friday at noon for this update. This forum is being brought to you live by PAC TV on Comcast channels 13 and 15 and Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email us at plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. And today's participants include Chair of the Plymouth Board of Selectmen, Kenneth Tavares, Matt Muratore. He is our Plymouth State Representative. And today we also have for participants Birgitta Kuehn. She is the Chairwoman for the Plymouth Board of Health. Also Dr. Mark Wilson. He's the active Professor Emeritus, University of Michigan, School of Public Health, Department of Epidemiology. Also Dan Harold. He is Principal at Federal Furnace Elementary School. Stephen Cole. He is the Executive Director for the Plymouth Regional Economic Development Foundation, and Lawrence Pizer, Plymouth Town Clerk. And at this time, we'd like to welcome Kenneth Tavares, Chair of the Plymouth Board of Selectmen, for your opening statement. Welcome, Ken.
Thank you, Steve. Good afternoon, everyone. A couple of updates for you. I want to assure the citizens of Plymouth that our fiscal affairs are being looked after. The town manager, the director of finance, and other staff members have been working on various scenarios as to how it could possibly look. They will be doing a presentation at the Board of Selectmen's meeting next Tuesday, and we'll begin a dialogue and also getting some direction from the Board of Selectmen as to where we should be going. We're trying to make decisions based on fact and the best information that we have available. Also, I know a number of people are concerned about when these decisions are going to be made. We are, I remind everyone, governed by a charter that has proved very effective for the town, and we will continue to run the town's day-to-day business as usual, if you can consider better than half the staff not being in the town hall building. Also, we're going to have a good example of what happens when inaccurate information gets out into the public and how it begins a firestorm. We're fortunate to have the chairman of the Board of Health here today to set the record straight as to some of the action that they took yesterday at their meeting. Once again, we certainly appreciate the opportunity to work with PAC TV and have this program, because it gives us the pulpit that we need to correct information that is spreading in the community and not accurate. Thank you.
Thank you, and that's Kenneth Tavares, Chair of the Plymouth Board of Selectmen, and a great lead-in for today's presentation. It's date-stamped on the top right-hand corner, so you know that on April 23rd, 2020, you're seeing this live. We're trying to provide you with verified information from officials from the town of Plymouth and also experts in fields that are responding to the coronavirus. We have a great panel today, and following up about setting the record straight, we've invited Birgitta Kuehn, Chairwoman of the Plymouth Board of Health, to rejoin us today so that she can further explain and to our viewers the order from the Board of Health that was voted yesterday. Welcome, Birgitta.
Well, thank you, Steve, and thank you for the lead-in, Selectman Tavares. So I wanted to say, based on the recommendation of the Board of Health Subcommittee on Coronavirus Guidelines, Directives, and Orders, staffed by Drs. Potvin and Turkelson, the number of municipalities requiring facial coverings as an order of the Board of Health has increased significantly in Massachusetts. Therefore, a proposal was presented to the Board of Health at its meeting yesterday and passed. The title of the order reads, Order of the Board of Health, effective Wednesday, April 29th, 2020, directing all individuals in the town of Plymouth to undertake further precautions to protect others from the spread of COVID-19. It seems that there was confusion in the media, probably last night, but definitely this morning, regarding this order, and it may have to do with an order imposed by a neighboring town. I'd like to clarify that the order does not go into effect until April 29th, and that it does not impose a fine for not wearing a facial covering. Again, it does not impose a fine for not wearing a facial covering. The select board will hear whether a fine will be imposed to those improperly disposing of masks and gloves and other PPE, which is personal protective equipment, that may present a health hazard to others. To learn more about this, I'm asking residents and businesses to tune into the select board meeting next Tuesday, April 28th on PAC TV. Further, the order speaks mainly with specific directions to the essential businesses defined by Governor Baker's orders. It allows an opt-out by businesses if they document why facial coverings would present a hazard if used in their business. The order will be posted on the town website after the select board meeting on April 28th. The order has additional useful guidelines for residents and businesses, which will be attached on what constitutes a facial covering or a mask, how to make a mask, and how to remove the mask or launder a mask. So thank you, Steve.
Thank you, and that is Birgitta Kuehn. She is the chairwoman for the Plymouth Board of Health. She'll be available to answer your questions when we do our question and answer portion of today's forum. You can send your questions to plymouthinfo@pactv.org. And next, we welcome back Dr. Mark Wilson. He is from the University of Michigan School of Public Health, Department of Epidemiology. And Mark, since the last time you were with us, we're hearing lots of information about testing and tracing, about an apex, a plateau, and in the past few days, some mixed messages at the federal level about whether or not the data that we've collected suggests a second wave coming back next fall or next winter. Since you're an epidemiologist, please tell our viewers what we might expect locally in Plymouth, maybe Plymouth County or Massachusetts, since you've been looking at the data. Welcome.
Thanks, Steve. Yes, there are a number of kinds of measures that we're all hearing about, and many of us are learning about for the first time. And I thought spending a little time talking about that might be very useful to the listeners. So first of all, there are fundamentally two different types of tests. One test is a virus test, and the other is an antibody test. What do we mean by these two different types of tests? The virus is an RNA virus, and it's what provokes the antibodies that our bodies produce when we're exposed to these viruses. So the virus test or antigen test looks for the RNA, the genetic material, in the nose or throat swabs that people are being tested with. And the idea is that this test then will give information about whether or not someone was infected. The antibody test, on the other hand, looks for a response to having been infected. These are the proteins that are called antibodies, and they are produced once an infection occurs in a person. This is a completely separate test. These two tests are both very specific to the SARS-CoV-2 virus, the virus that causes COVID-19 disease. They've taken a while to develop, which is not surprising. This is a new virus, but it's not entirely new because some very close relatives have produced SARS disease and MERS disease, and the coronaviruses that cause those two diseases, two different ones, are closely related to the third one, SARS-CoV-2 that causes the disease that we're all struggling with in the world today. Many different groups are producing these two different types of tests, pharmaceutical groups, government, university, and so forth. They're all working on these, trying to develop them as fast as possible. And so we're hoping that in the very near future, there'll be tests that are accurate, available to a large number of people. Right now, they're nowhere near enough. But part of that also reflects these two different types of tests. So let me just mention again, the virus test that looks for the antigen for the virus or indication of the virus will tell us who is currently infected and presumably infectious. So if I get a positive virus test, it means that I am likely to be able to transmit to someone who's close to me. So it helps us to determine who should be in quarantine or in isolation. It allows for contact tracing. So those contacts that we've had, if we are virus positive, could have been exposed, and we want to know who those people are in order to inform them and ask them to consider self-isolating. Another thing that's very useful potentially with the virus test or the antigen test is that you might be detectable at a time before symptoms appear. So this gives you an early warning. So you'll even be better equipped to isolate yourself and try to reduce the likelihood of transmitting to someone else. That's only if this antigen test is administered before symptoms appear. And right now that's not happening. But this is something that we could potentially do in the future. The other test, the antibody test, tells us who was previously infected. So if I have antibodies, it means that I had the exposure to the virus produced these antibodies in me. And it's an indication of people who were previously infected, but probably are not still infectious. We're not sure about this, how long someone remains infectious after producing antibodies. But it also suggests in the long run that we're unlikely to be reinfected. So if we have antibodies, the normal way in which this would result in protection is we would have antibodies that would keep us from being reinfected if exposed again. How long this occurs, we don't know. This is still a big unknown question. For other coronaviruses and many other viruses, it's on the order of years. It may be a few years. We won't know this for quite a while now. But in the meantime, people who have been exposed, have antibodies, may be protected for months to years. So these are individual level pieces of information that we can all benefit from at the individual level, but then there are population level applications. And here's where we begin to see patterns in space. So the virus tests will help us to describe the proportion of people in a city who have tested positive for infection, or in a state, or in a region. It'll also show us these curves that we're all now familiar with from watching the reports on the TV and elsewhere. And these curves represent an indication of the rate of change of either new infections or eventually we'll have antibodies. And I think there are two different ways to think about this. One is the number of new cases each day or each week. It's usually each day now. And as that number of new cases becomes less and less each new day, we're approaching what's called the plateau or apex. And then as there are fewer one day after the next, there's a decline. So that's an obvious increase, plateau, and decline in the number of new infections. But there's another one that we're seeing as well, which might be a bit confusing, and that's the total number of cases. It's a cumulative number. And as that increases, as the rate of increase declines, we're also in some ways favoring ourselves by having fewer new cases appear. So there are different ways to portray this, but these antibody tests, these antigen tests that indicate who's positive are based on those. As far as the antibody tests are concerned, the one important piece of information that eventually we'll be able to glean from this is what proportion of the population was infected and may be protected. Right now, we don't have widespread antibody tests available, the results of those available, but recent observations in a few locations, focused studies that have a fairly large number of testing samples analyzed, have indicated that many more people than we once thought apparently are being infected but show no symptoms. So they're not being counted. This suggests, on one hand, that those people might be infectious unknowingly, but on the other hand, the good news is they may actually, without having any symptoms, become protected. It's a kind of natural vaccination. And so this is the kind of process that naturally occurs without vaccination, and it'll actually aid in vaccination once we're eventually able to use that. Let me pause there, and of course, I'm happy to answer any questions that the viewers might have as we continue.
Thank you. That is Dr. Mark Wilson. He is the active professor emeritus from the University of Michigan. He'll be available along with our other members of our panel to answer your questions. Send them to PlymouthInfo@pactv.org. We have been receiving questions today, but we're now going to go to Daniel Harold. He is the principal for Federal Furnace Elementary School. And in the interest of full disclosure, I want to mention the fact that in another life, Dan was the principal at Indian Brook Elementary. And Dan, I want to thank you for mentoring my daughter, Courtney, who was the moderate special needs teacher when you were there, but she's now the assistant principal. So thank you for all of your support and tutelage, and welcome.
Well, thank you for having me, and I'll thank you back because she has and always will be a phenomenal asset to the Plymouth Public Schools. Yeah, my lens is a little different. I know there have been quite a few central office staff that have come on and shared with you their insight related to the rollout of a virtual school that we've had to create. And I'm going to just kind of back up just a little bit because, again, the lens is a little bit different. We basically have had 3 phases of supporting students and families. The first phase, I will say, was a little bit crazy. It was trying to get all of that technology and information to parents in a manner of which we're not used to. We were used to providing information via the child and we send it home or what have you. And suddenly we were responsible to get it out to them in a virtual manner. So it was a little difficult. We communicated. I know all of the elementary principals, I can say we're very supportive of one another. We have been very collaborative through this process and have helped one another in that rollout, whether it be Chromebooks or supports for kids related to lunches or materials or what have you. So it's been a really concerted effort. I've never seen a district come together like we have over the course of this situation that we've been put into. I cannot speak highly enough of the teachers and the support staff, not just at my building, but I know from hearing from the other elementary principals of all the buildings, the teachers have just been outstanding, whether it's weekly lesson plans, reaching out to families to support them that are struggling, whether it's been helping them to get even food. All of our elementaries have a Food for Kids program, and now suddenly we can't provide that, and how the community has stepped up to fill that void. It's just every facet of the student life has been, it really has been continued in just a very different manner. And again, I know just before we got on the air today, I received information from the head of the cafeteria, Mr. Van Cod, who had said that, the lunches that basically cater to Federal Furnace students, we're serving 125 kids a day. So things are still happening and still being supported. And I think that is really been a phenomenal feature of all this. Then we kind of went to phase 2. And phase 2 was right after we found out, we're not coming back until May 4th, as we all knew. And that it did change a bit. I mean, we did find that the teachers are now creating weekly lesson plans in a very collaborative way. And it's just amazing how, things that we never used before are suddenly being used, such as, Zooms and, the Google Shared Drive, where people are going in and working together at the same time to create lesson plans and support the kids. As I said, the elementary principals, we have Zooms on a regular basis to discuss things that impact all of us at our level and support. So again, it's really been collaborative, and I know I'm going to say it again. It's that teacher support and the other building supports that we have that have just stepped up unbelievably. Also in phase two, we definitely saw an increase of virtual supports, and I'm talking about that from special educators as well as our counselors. They're literally going on and they're connecting daily with the children and supporting them in any areas that they need help with, whether it's mental health or the academics. And again, it's happening daily to continue to make sure that our children can have success in this virtual environment. So it really has been beneficial. We are seeing, and I must share, from the help of one of the other principals at Hedge, Kristen Wilson, and myself, we started to have to address families that are struggling with the virtual and finding it too difficult, whether it's because they have numerous children at home and the technology piece, or if they're just finding it overwhelming. But we've started providing take-home bags that are 2-week bags that basically supply parents with work, meaningful work, that covers a 2-week window of time. And then we'll rotate and provide new materials and collect that they've completed from the previous week. So that started in phase two. And then we all know we got word on Tuesday that phase three is for the duration of the year. So we basically have about 8 weeks left, of which we are definitely going to continue this online schooling program. And I do see a little bit of a change as we move into phase three, because I'm getting increased contact from parents, as other elementary principals are, related to technology needs, related to additional supports now that they know that they're going to be supporting their children at home for an additional 8 weeks. I think that's one of the things I probably should have mentioned earlier, that elementary is, I think, vastly different than secondary in the sense that many of our children, they do need support daily from the parents to continue that academic structure at home. And that does rely on the families immensely. And as we know, many families are still working, whether it be from home or outside of the home still. So that is an added area that we're going to need to address, I think, for the next 8 weeks as we move forward through all of this. And we're there. But again, the emails I'm receiving from the parents, the emails I'm receiving from the students, the pictures from the students, it really, it's a true sense of community now, and everybody's come together and is making it work. And I think that's what's important to take away.
Thank you. And that's Dan Harold. He is a principal at Fairfield Furnace Elementary School. He's available to answer questions. Send them to PlymouthInfo@pactv.org. And you'll be hearing in a little while, we're going to be hearing from secondary level principals tomorrow during our daily update. But at this time, we're going to go back to Lawrence Pizer, who is rejoining us. He is our town clerk, and he's going to talk about some of the elections that are coming up. Welcome, Larry.
Thanks, Steve. As I hope people know, the town election has been moved to June 20th, and we think that we should be in pretty good shape to run that election. There is also an election, the special state election to fill the state Senate seat formerly held by Vinny DiMacedo. It's right now scheduled for May 19th. I'm not very hopeful that we will be ready to run that election, but that's what's scheduled right now. So I hope people will stay tuned to figure out exactly when the election is. But I hope that a lot of people are expecting to vote by mail, and we are going to make it as easy as possible for people to do that. First of all, it is not required that somebody have a form in order to request a mail-in ballot. It's entirely proper for someone to write on a piece of paper, I am, and put down their name. I live at, put down their address at which they're registered to vote. Please send me an early mail-in ballot. And then there are many ways of getting it to the clerk's office. One way is to put it in the Dropbox. If you stand at the upper entrance to Town Hall and look to your left, there is a medium small silver depository. You lift up the handle, and then there's a slot in which to place the material that you want to do. Usually it's used for tax bills, excuse me, but it can also be used for mail-in ballots. Second way of doing that is to write out the form that we talked about and then take a picture of it with your cell phone and email it to Reardon, Reardon, excuse me, at townhall.plymouth.ma.us. We will get that processed as well. If you want to use the forms, they are available on the town's website. The town's website is plymouth-ma.gov. Click on Quick Links, and those ballots will be available. I believe it begins with COVID-19. Just so that people understand, the election by law has to be available in person as well as by mail. And therefore, part of the problems that we're facing for the proposed election for May 19th is manning the locations for all of the precincts. In addition, all of the ballots have to be processed through the town's equipment, and that has to be processed during the election hours. So we are, if you mail in your ballot, the ballot will have to go into the town's equipment, but we will take care of that in the process. On a few other matters, we are actually beginning to catch up with vital records. All of the deaths and marriages and births that have occurred, we think, are being registered, and therefore it is possible for people who need certified copies. If you just had a baby, you probably do need a certified copy of the birth certificate. And certainly the same is true with death certificates. The best way of getting them is, again, to go to the town's website, plymouth-ma.gov, look for online purchases, town clerk, and then look for the specific record that you're looking for. I observe these. I try to do it on a daily basis, and I try to fulfill them as quickly as I possibly can. Some people have been asking about dog licenses, and that hasn't been our top priority, but we are now able to process some dog licenses. Again, if you haven't paid for your dog license, the best way to do that is through the town's website. We are hoping to be very close to being caught up by midweek next week. One final question people have been asking about is, what if we would like to get married? We are working with the state to develop a system whereby we can do this without person-to-person contact. We have not yet received permission for that, but that's something on the horizon. Be happy to answer questions when they come. Thank you, Steve.
That's Lawrence Pizer. He is Plymouth Town Clerk. Send your questions, PlymouthInfo@pactv.org. We're going to go to Stephen Cole. He's the Executive Director, Plymouth Regional Economic Development Foundation. Welcome, Steve.
Hi, Steve. Hope you can hear me. I had to switch to a headset because there's some yard work going on in the background. So,
We can hear you.
Perfect. Thank you, sir. Thank you for having me back for another edition of As My Beard Grows, home edition. Last time I was here, I talked a little bit about how Massachusetts fared in the PPP payouts, as well as what we can expect from the unemployment insurance numbers. I got a question after that show about how these numbers compare to the so-called Great Recession. At the height of the Great Recession in March 2009, I was able to get some numbers from the Federal Reserve Bank of Boston, New England Public Policy Center. Just recently released a fairly comprehensive report called Economic Fallout of the COVID-19 Pandemic in New England. They do a fairly comprehensive breakout of the New England states. Massachusetts, as you can imagine, being the largest of the New England states, has some of the higher numbers and proportions than some of the smaller states. But nonetheless, we seem to be doing fairly well. And I just want to share with you some of those numbers. At the height of the Great Recession in March 2019, the construction industry was about 20% of unemployment filings. As of April 4th this year, they were about 8.8% of unemployment filings. Similarly, manufacturing was about 13% back in March 2009. As of April 4th this year, it's 4.5%. The services are taking the biggest hit, as we can imagine, and those numbers were actually much better for that sector in the Great Recession. 36.4% of unemployment claims were coming from the service sectors, whereas today, as of April 4th, 53% of unemployment claims. The trades, they saw also a bit of an increase, 12% during Great Recession, and they're close to 14.5% presently. Some other analysis that's coming out of the Reserve Bank, they anticipate 36% of renters and 18% of homeowners are going to have difficulty making their monthly payments. That translates in real numbers to about $1.5 billion. How that affects us? Well, last time I was here, I talked a little bit about second homes. It's no secret that, especially in continental Cape Cod, our area, and peninsular Cape Cod, out on the Barnstable County, second homes are a thing. It's something that we expect. There's obviously a lot of out-of-state homeowners too, New York and Connecticut. We expect some disruptions in the housing market. As I said, to give some optimism, my sense though is that either those second homeowners are going to sell their homes and to free up some of that housing tightness that we've seen in the market at 2% vacancy. Not a lot of families are able to start their own homes. And most of what we're building right now are 55 plus age restricted. So my sense is that this will free up some of the housing market. Also, what we might see is some of those second homeowners converting from week-to-week rentals to year-round rentals. And I think that's being reflected in these numbers also. I'm available for more questions, but I do want to leave you with one final thought here too with unemployment filings year to date. Out of the New England states, no, forgive me, this actually stat is nationwide. Rhode Island is actually the highest unemployment filings in the United States at this time. Massachusetts is 7th. I'm very glad to answer any questions, and if anybody has anything that they would like for me to research for my time next week, send me an email or send it through the network, and I'll be very glad to do so. Thank you, Steve.
Thank you. That's Stephen Cole, the Executive Director, Plymouth Regional Economic Development Foundation. We're now going to move to our Plymouth State Representative, Mathew Muratore, for your daily update. Welcome, Matt.
Good afternoon, Steve. Good afternoon, everyone. I just want to work off of what Stephen Cole just said, too, on the unemployment. The mass numbers just came in as 80,000 more Massachusetts employees that just were added to unemployment last week, which brings the total amount to over 650,000 just in Massachusetts. And almost a third of those are restaurant workers. So it's sort of some interesting statistics, and we expect those to keep rising. With regard to the governor's actually speaking right now, and the one thing he is stressing, and he has 3 CEOs with him from the hospital industry, Boston hospitals, and they're really stressing, as we just touched upon yesterday, to do not delay care. If you have an illness or you have something that's an issue, contact your PCP and don't delay to have to go to the hospital for any sort of illness or infection or whatever you may have. They're really stressing this. The hospital capacity is still running at 56% open beds in the Commonwealth. That includes about 15% of those beds are ICU beds. So we do have a lot of beds, even though we're in the surge right now, we still have a lot of beds open. But by delaying care, you could really do harm to yourself. So you want to make sure you don't do that. So that's the big message coming out of the governor today. In looking at some numbers for today that actually came out as of yesterday, we have 183,462 people that have been tested to date. That's an increase of 5,090 from the day before, or 2.6%. Of those, 42,944 have been confirmed cases, which is an increase of 1,745 from yesterday. And as we talked yesterday we had 6 days in a row where the confirmed cases of the COVID-19 were coming down. But unfortunately, the number just shot back up again with these numbers that came in yesterday. So that's 23.8% of those that are tested have been confirmed with COVID-19. Of those that have been confirmed, there are currently a little less than 4,000 that are hospitalized, which is 9% of those confirmed cases are hospitalized at this point, with an average age of 68 years old. The average age of somebody that's confirmed with COVID-19 is 54 years old. The number of deaths shot up to the highest amount we've seen on one daily total by 221 yesterday, to a total of 2,182 deaths, which is a 0.5% of those. Which is 5% of those that have been confirmed with the coronavirus. 55% of those now are in long-term care facilities, so more than half of those deaths have been from those long-term care facilities. And as we discussed, long-term care facilities are skilled nursing facilities, assisted livings, and rest homes. And the average age of the deaths are at 82 years old, and 98% of all deaths have had some underlying health condition. Speaking of the, before I go to long-term care, Plymouth County, they increased their cases to 210 cases of confirmed coronavirus cases to 3,253. And there were 157 deaths in Plymouth County, which is 0.03% of the population of Plymouth County. And Plymouth numbers just came out this morning at 131, which is 0.25% of the population of Plymouth have been confirmed with the coronavirus. With long-term care facilities, there have been 7,721 confirmed cases. This is out of well over 70,000, close to 70,000 people in these facilities, with at least one case confirmed in 273 out of the close to 700 facilities. As I said, the hospital capacities are in good shape at this point. There are beds available. Same with the PPE. Gowns are a little bit down, but the command center continues to work on getting supplies in, and we still encourage all the healthcare providers and hospitals and these other places to continue ordering from usual places. But we're seeing that supplies are okay at this point. Couple updates on the state level, on the State House level. Yesterday, the governor announced a food security task force has been launched. As Dan was talking about feeding the school children in the town, and this is going to continue for another 8 weeks, if not longer. Then the state realizes there's going to be need for food and for funding, so that's being looked at this point. The Notary Bill, Steve, I know you're interested in this as well as many other attorneys and real estate people. The Notary Bill, the virtual bill to do notary work, has passed the House today as well. So yesterday it passed the Senate and it passed the House today. We expect it to go through the process today, and hopefully by tomorrow get on the governor's desk for a signature. And finally, I just wanted to talk briefly about, and I know Mark was talking a lot about testing and tracing, and a lot of folks are talking about how the economy is going to open and what it's going to look like. As the governor keeps saying, and I know Chairman Tavares keeps saying as well, we're not there yet. And as you saw here in Plymouth and the surrounding areas, we're being asked now going to be asked to wear face masks when in public, period. These numbers are not going down yet. We are a hot spot of the whole nation and the world right now. And we need to adhere to what the public health folks are telling us. Stay inside. If you have to go out, wear a mask. There's not a time that you shouldn't be doing what the public health people are asking you to do. The economy will open up at some point. Good chances are it's not going to be May 4th. It's going to be some time after that. And I know some of the discussions have been that it may not look like essentials and non-essential personnel or places that will have to be open. It's going to be strict guidelines of what policies you're going to be able to follow in order to open up your place of business. Representative Muratore and myself will be doing, we'll be on the chamber meeting tomorrow virtually. That's open up to the public. We're going to be talking about a post-pandemic economy. So if folks want to join tomorrow at 10 o'clock, they can go to the chamber website to find the information, but we're going to be talking about what that's going to look like. But if you are a business, you're going to need to change how business has been done in the past, with regard to cleaning and with regard to PPE, the personal protection equipment, and all sorts of other things that may have to happen for you to actually open up. So we'll talk more about that at 10 a.m. tomorrow in the chamber if anyone's interested in joining that. And finally, ways that people can help. There's the Mass COVID-19 Relief Fund has over $26 million in it and growing. That's one way people can help. You can volunteer as health professionals. You can volunteer, as Mark was talking about, the tracing with tracing. And by the way, if you're getting a call from COVID-19 MA comes up on your phone, that is the state calling you about tracing. They're trying to get some information about you have flagged because you have been confirmed with a case of COVID-19, and they're trying to do a tracing on this. Because in order for the economy to open, we have to more than double the amount of tests that we're doing now, and we have to do this tracing as quickly as possible. So they are looking for volunteers, for people who want to do some tracing work. And again, if you have personal protective equipment to donate or sell, they're looking for that. And they're also looking for part-time healthcare workers that they'll pay as well. And finally, the Red Cross. Red Cross is still looking for blood needs, whether you could do platelets or give blood. They are still in need of that. So please reach out to them, redcrossblood.org. And that's the update for today, Steve.
Thank you. That's Representative Mathew Muratore, representative for the town of Plymouth. Yesterday, Sarah Cloud from Beth Israel Deaconess in Plymouth told us that the local Plymouth campus does have capacity to receive more patients, and she's going to be joining us now each week with an update from our local hospital. Tomorrow, Matt and Ken and I will be joined by Brian Palladino. He is a principal at Plymouth Community Intermediate School. Also, Peter Parslin. He's the principal at Plymouth North High School. Dr. Philip Triffletti. He is a primary care physician at Beth Israel Deaconess. Roxanne Whitbeck is the veterans agent, and we'll be joined by Amy Naples on the business segment from the Plymouth Area Chamber of Commerce. We have a number of questions. You can send them to PlymouthInfo@pactv.org. We're going to go right through our guest participants today, beginning with Birgitta. Birgitta, first we have a series of mask questions, and one of the questions is a viewer talked about someone coming in with a ski mask to a local business, and it was a little disconcerting to that person. Can you comment about the use of ski masks and also about wearing masks into a bank? There's a local bank in Plymouth that doesn't have a drive-through, and their lobby is opened, and the viewer was uncomfortable about wearing a mask into a bank. And finally, another question had to do with wearing masks out in public. Does the new order relate to people who are not congregating but are outdoors exercising, walking, running, or sitting on a bench at safe distances? Are they required to wear a mask? Can you comment on the masks?
Sure, Steve, and really, I appreciate those questions. I think that it's important and has been important to all the Board of Health members to let the public know that they have actually learned a lot about masks over the last several weeks. And masks is a term actually that we have not stopped using uh, in order to say that we would like people to cover their faces. So we're talking about facial covering, and we're talking about covering the nose and the mouth. I really believe that facial covering as a whole makes people uncomfortable because it's something we're not used to. We're just getting used to this. And excuse me, let me turn this off. I apologize. And we're just beginning to get comfortable recognizing that masks are protecting others from us. So, what sort of mask you decide to wear and how a business actually decides to define what masks are appropriate within their business. If a bank is uncomfortable with a mask, they can post a sign at the door or they can post a person at the door to have a discussion. Uh, it's really up to the business and it's really up to everyone's own personal judgment. If they feel that they look um, inappropriate for the environment in which they are, I think they should take that into consideration. We're all in this together to do the right thing.
Thank you, Birgitta. Second question, has the Board of Health determined whether or not it'll be granting pool opening permits to public or semi-private pools?
What I'd like to say is, at this time, we're not going to be opening um, uh, any congregate places, but a semi-private pool could be a backyard pool. And if backyard pool has only one person, that's not a congregate situation. So I don't have an exact answer for that. The Department of Public Health and the Board of Health will have that discussion, but I don't believe that anyone will be swimming in the near future unless they have a heated pool. And in that case, they can write to or call the Department of Public Health.
Thank you, Brigitte Kuehn. She's the chairwoman, Plymouth Board of Health. Next to Dr. Mark Wilson. Mark, of your rights, China recovered. In China, there are reported cases that individuals recovered from the coronavirus and then became reinfected. Is that possible?
From everything that we know, based on other viruses and other studies, it's very unlikely. A more likely explanation is that the test was false. And this is a big problem that we face with the tests that are available today, is that they haven't all been thoroughly investigated as far as what proportion are false negatives or false positives, nor for their sensitivity or specificity. And so this creates a big problem in terms of trying to focus on individual level reinfection possibilities. It's very unlikely, but it is possible. And I say that simply out of an abundance of caution. This is a new virus and we don't know. It's not a human virus either, which is the other important thing to keep in mind. So some of the ways that we've come to understand patterns in the past may not apply in the same way to this particular virus. But I think it's also important to keep in mind this distinction, this difference between infection and disease. You need to be infected to have the disease, but you don't have to have the infection. Sorry, you don't have to have the disease if you're infected. And so back to what Birgitta was saying, we really need to keep in mind the reason we're using masks is in the event that we are infected and infectious, we're protecting our friends and neighbors or family members for that matter. And we don't know simply. And so wearing a mask, if we are infectious and infected but don't feel bad, makes a whole lot of sense. And so that's the basis for this ruling.
Second question, and I'm not sure if it's for Dr. Wilson or one of the other participants, but we've been hearing about the testing and the contact tracing, And we know that at the local hospital, there have been testing for responders, and Representative Muratore did mention that you may be contacted for someone doing contact tracing. But Dr. Wilson, are you aware of what is or could be done locally in order to do increased testing or contact tracing?
This would be organized by the appropriate health agencies. And the simple answer is it's a whole lot of work, but in some contexts can be very, very valuable. It requires identifying who is infected and therefore probably infectious and who they were in contact with. And this is the effort that is so time consuming, is finding who all was in contact over a certain period of time, contacting them, discussing it with them, and informing them of that exposure possibility, and then asking them to self-quarantine and to monitor themselves carefully. It's something that in an early stage of an outbreak makes a whole lot of sense. Right now, we're simply overwhelmed. And so it's going to be very difficult to do that, but eventually, when we have enough contact tracers available, something that could be very valuable.
Thank you, Dr. Mark Wilson is an epidemiologist, and he lives right here in Plymouth. We're going to next go back to Dan Harold, Principal of Federal Furnace. Dan, can you confirm the last day of classes for elementary school students and anything special yet planned for rising sixth graders who will be fifth graders going on to sixth grade?
Can you hear me?
Yes, Dan.
Okay. Related to the last day of school, because, and I know it was on reported last week by, I think, Ms. Fry, that we gave up April vacation. So the week we're supposed to be off right now. And right now, the last day of school will be June 19th. That will be the last date for school for Plymouth. I can't speak for other communities. The end of year events, because we only got word from the governor, Tuesday, that we are now going to a virtual for the remainder of the year. We are in the exploratory stages of looking at how we might be able to, in the future, because we don't know until we get guidance from the governor, local agencies, as to when we can have small to medium to large groups together again. So until that is determined, we don't know, we can't schedule a date, but we are looking at what are the important end of year events that we would like to have if we are able to have them in the future. For example, I know most of the schools have a grade 5 promotion day. When could we do that? It's similar to a graduation at the high school. So we are compiling that list collectively at the elementary level. In fact, we're going to have a conversation around that this afternoon when we Zoom as a group. And look at that. And then once we get guidance from one of those agencies as to what we can and when we can have those things, we will look at scheduling them.
Thank you. Dan Harold is the principal, Federal Furnace Elementary School. We're now going to go to Lawrence Pizer. And Mr. Pizer, as town clerk, 2 questions. First, do you prefer to receive requests for early ballots by email or by Dropbox or by mail? And second, can a voter make one request for both the special election early ballot and the town election ballot?
We'll leave the mode of delivery to the public. We'll be happy to receive the requests however they come. And I should remind people that when they make the requests, make sure that they sign what people call a wet signature. In other words, sign with your hand the request. So as far as that is concerned, send it any way that you want. That's perfectly fine. Also want to remind people that with all of this changing of election days that we've had, if you have submitted your ballot, it's good. You only have to do that once. And so that the town election was originally scheduled for May 16th. If you sent it in for May 16th, even though the election's going to be held on June 20th, your ballot is perfectly good.
Thank you. And could you give the spelling for Reardon? You said R. Reardon earlier. How do you spell Reardon?
Okay, R-E-A-R-D-O-N. first initial is R, so it's RREARDON at townhall.plymouth.ma.us.
Thank you, Lawrence Pizer, Town Clerk. Going to Stephen Cole, Executive Director, Plymouth Regional Economic Development Foundation. Steve, a viewer writes that the viewer applied for the PPP funds and did not receive them because funds ran out. Does the viewer need to reapply in order to be reconsidered?
Yes, Steve. He will have to reapply as this is going to be considered a separate program.
Thank you. Next question to Matt Muratore. Matt, the first question would be with respect to landlords and tenants. We've been talking about some of the bills, but the viewer writes, if tenants are positive, does the landlord have a responsibility to disclose that information?
I'm sorry, can you repeat that again? I'm not sure I understand that.
The viewer's question was, if a tenant is diagnosed as positive and a landlord is aware of that, is the landlord obligated to disclose that to other tenants?
No, as Birgitta said, that's a HIPAA violation. There's no, they can't talk about that.
Second question for Representative Muratore. The governor's state emergency order issues back in March now expires May 4th. Is there any expectation that with our state numbers on the rise that the governor may extend that date?
Must be a viewer that just turned in, because I just talked about that. I expect that date to be changed. As I said, our numbers are increasing at still an alarming rate, and we're going to need at least a good 2 solid weeks of numbers going down. So I do not expect that the date of May 4th will stay. I expect that will be extended.
Thank you. And we're going to quickly go around to our panel for one last comment, beginning with Birgitta Kuehn. What would be a takeaway or final message you'd like to leave with our viewers today?
Thanks, Steve. I want to strongly agree with what was presented by Representative Muratore. I would want the public to please understand that we are still experiencing a pandemic surge in Plymouth. It's also important to understand that public health and economic health go hand in hand. We cannot have one without the other. In order for our numbers to start going down so that we can begin to open town, it's a very small price to pay to require our essential businesses to participate in recovery with facial coverings. I also want to add that starting May 1st, through the governor's orders, the Community Tracing Collaborative through Partners in Health will be doing all the contact tracing for all municipalities in Massachusetts, except for some specific carve-outs, such as group settings or complex cases. So please give it a try. You may like to be a contact tracer, and the easiest website to go to take a look at it is M as in Mary, H as in Henry, OA.com, which is the Massachusetts Health Officers Association, and all the information is there. And I want to leave you with one more. Do not delay your care. The hospitals will take care of you, and you will get the care that you need and deserve. Thank you, Steve.
Thank you, Birgitta Kuehn. She is the chairwoman for the Plymouth Board of Health. We're going to go to Dr. Mark Wilson. Dr. Wilson, what are your final thoughts today?
Very simply, you may be infectious and be healthy and not have symptoms. Wear a mask. Keep your distance.
That's Dr. Mark Wilson, active professor emeritus, University of Michigan School of Public Health, Department of Epidemiology, and a Plymouth resident. We're going to go to Dan Harold, principal at Federal Furnace Elementary. Dan, what is a takeaway you'd like people to remember today?
I want to reach out to the families of Plymouth, really, and just state that we're here to support anything you need help with, not just with the academics, but if it's mental health, if it's economic supports that we might be able to figure out to help, we're here to help. And just please reach out to your child's teacher, reach out to us directly in the building. But I mean, we really, there's not a person I've been in contact with that hasn't really stepped up and to support. And but we just need to know. And so that would be my final takeaway with them, with the parents is please reach out to us.
Thank you, Dan Harold, Principal, Federal Furnace Elementary. We're going to go to Lawrence Pizer, Town Clerk. And Mr. Pizer, we actually received another question as you give your final thoughts. The viewer says, in March, I sent a postcard asking for an absentee ballot. I received nothing. Have the ballots been sent out or not? If yes, could you recap how I'd go about requesting the ballots for both elections? And also, please give us your final thoughts, Mr. Pizer.
Sure. No, a lot of the ballots have not gone out. In order to get the ballots out, we need access to the office, and we've had very little access to the office. We're working very hard to do it as quickly as we can, even though the number of hours that we have in the office are pretty small. So if you've applied, you will get a ballot, but it should not be surprising to someone who's applied that it hasn't come yet. So as that should be fairly clear. If you'd like to get in touch, if anyone has questions of the clerk's office, the fastest way of getting in touch with us is by going to the website, clicking on departments, clicking on town clerk, and then there is a contact file. And you can leave a message for the town clerk. They come directly to my email, and I can respond that way. Happy to do it.
Thank you, Lawrence Pizer, Town Clerk, Town of Plymouth. Stephen Cole, we're receiving lots of information today, medical information, government information, economic. What are your final thoughts?
Well, I guess in the vein of all of that, it's important to note that as the Board of Health Chairwoman said, that you have to be healthy. If we're going to have a robust economic recovery, you have to be healthy. Part of being healthy means not only being active. Problem solving is something I'm trying to nudge people towards. There will be a time when businesses will have to start to recover. New types of businesses will start to form. Start to think about the types of problems you want to solve. That's the start of how most businesses start or fall or form. Start to think about the problem you want to solve. From there, you start to coalesce the types of resources. Plymouth is a place where you will be able to invest and be successful in the new economy. Something I'm doing, though, is pivoting a little bit, reading more for leisure, and that kind of introduces new types of problems and new types of information to me. A book I just finished reading was called The Tangled Tree by David Kuehn. Some interesting stat that I pulled from that I think our doctor guests might find curious too is that about 8% of the human genome actually contains viral DNA. 3% is actually pre-human from Neanderthals. So humans are theoretically more viral than pre-human. So if that tells me anything as an amateur reader of this type of subject matter is we're going to acquire the best features from this viral DNA, and as a species, we will be stronger for it.
Stephen Cole is the Executive Director, Plymouth Regional Economic Development Foundation. Representative Mathew Muratore, this is our 30th daily update. We've been doing this now for over a month. What are your final thoughts?
Well, first of all, I'm running out of pictures after 30 days. So I'm starting to recycle new pictures now. So people ask, I run out. So I have to create some new ones too. The theme today, I think everyone's been great. Thank you again for all the guests. But I think the theme that I can take out of this today is, I know people want to get back to the economy. I do as well as a small business owner. I have 2 small businesses, childcare and healthcare, and I really want to get back as well. But as the health experts on this panel, Dr. Wilson and the chairwoman indicated, we need to all be healthy first. Now, we all may not know somebody who has the coronavirus. It's out of the entire population of 7 million people, it's a very small percentage. So we may not know anybody, let alone know somebody has died. But if you don't hear anything today or hear anything that I've ever said in the last 30 shows that we've done, listen to the people that are dying. 55% of those are seniors who are living in long-term care facilities, who have not even gone out. So now we have to start thinking, well, how did they get this, number one, and how did they die from it if they're not going out? We're the ones that are still able to go out of our houses, but how did they? And I think as Dr. Wilson said, it goes back to whether you know you have it or not. You may not know it, but by being outside, by still having close contact with others, by not wearing masks, you are risking lives of people you probably have never met and never will meet. So I would ask you to keep that in mind. Let's try to do what we can to save these seniors who are living in these facilities that you'll never even meet or never even know. And as I say every day, stay informed. Stay informed by going to the mass.gov/COVID-19. Ask questions by calling 211. Get alerts through COVID MA to 888-777. And if you have health questions, go to bowie.com/mass. And again, the more we come together by staying apart, the faster we'll get back to the people we love and the things we love to do. So thanks again, Steve, and to all the guests, and once again to PAC TV for what you are doing.
Thank you, Representative Mathew Muratore, and to all our guests, Birgitta Kuehn, Dan Harold, Dr. Mark Wilson, Lawrence Pizer, Stephen Cole. And as we circle back to the chair of the Plymouth Board of Selectmen, Kenneth Tavares, you've also been with us for all 30 daily updates. We started over a month ago with these updates, and you've heard all the people today with their messages. I'm sure you would agree. I've certainly known some people that have been diagnosed with the coronavirus. It's a terrible condition for people to endure. And we know we have people right in Plymouth, unfortunately, who have been diagnosed. What are your closing thoughts today, Ken?
My thoughts center around a very common thread that's gone through today's program. We have to follow the numbers. They are key to what's going on. As Rep. Muratore said, we're not safe yet. We're not even halfway through the woods. And I just want to emphasize that the guidelines aren't punishment. We are trying to save lives and prevent sadness. And I think in our community, we're doing a decent job of that, but it's taking a lot of people to do it. And I am entirely supportive of actions that have been taken to place and appreciate everything that's being done by so many caregivers and people that care in this community. We're human. We're going to make some mistakes. Saw some of that happen this morning with false information going out. But with the opportunity to be able to talk to the community on a daily basis, we're able to correct them. There are so many stories out there, positive stories, people that are putting their best foot forward. That's what I want to embrace. There are some days that, in talking to many of you that have been on the panel and other folks that are calling in, we just say, we can't take one more day, but we can do it. This country has proven itself time and time again that we are strong and we will defeat this virus. Thank you.
Thank you, Kenneth Tavares, Chair of the Plymouth Board of Selectmen. And each day you will hear positive stories during this forum. Tomorrow, Dr. Philip Triffletti is a primary care physician, be talking about telehealth, telemedicine, and we'll be hearing from educators, Brian Palladino and Peter Parslin, both principals at the secondary level. Roxanne Whitbeck will be talking to us about our veterans and what new programs are being rolled out to support our veterans. Amy Naples talking about businesses, and always joined by Representative Mathew Muratore and Selectman Chair Kenneth Tavares. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us. Good day.